So welcome everyone to our webinar this evening called Blood Sugar Boot Camp. We're so happy you could join us this evening. Should you have any technical difficulties, there is a number at the bottom of the screen. Call Log Me In Support. Let's see, do you mind? Yeah, there, thank you. 1-800-263-6317. The webinar ID that you might need to reference at the bottom of the screen is 642-899-995. So we're so happy you're joining us this evening. Our program this evening is interactive. Our format includes a short presentation followed by an interactive discussion. So to type in a question, use the questions section of the webinar toolbar. You'll see a picture there on the right hand of your screen. At the end, you will have a chance to ask questions. So we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes. Please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our leader this evening is Andrea Castleberry. Andrea is a registered nurse and a certified diabetes care and education specialist who has coached with Cecilia Health for several years. She received her Bachelor's of Science in Nursing from Baylor University and is preparing to begin her Doctor of Nursing practice at Baylor University. She's passionate about spending time educating her patients so that they can live their lives to the fullest. In her spare time, Andrea enjoys spending time at the lake with her husband and two sons and two Australian shepherds. So thank you so much for joining us this evening, Andrea, and you may take it away.
Thank you so much. I'm excited to be here this evening and talk a little bit about blood glucose monitoring. So I appreciate the warm welcome and thanks all of you for joining us. So our agenda this evening, we're going to talk about a lot of things, but overall, we're going to talk about what's the benefit of self-monitoring blood glucose, which you may also refer to as SMBG. We'll talk about when and how to check, the importance of keeping a glucose log. We'll talk about what those numbers mean, what the target ranges mean, and how you should manage high blood sugars and low blood sugars as well. We'll talk about the frustrating dawn phenomenon. We'll also talk about high blood sugars and ketoacidosis and how to check for ketones. We'll talk about estimated average glucose level, or EAG, and hemoglobin A1C levels. And we'll also have the time, as Katie mentioned, for questions, answers, and sharing at the end. So I would appreciate you all joining us this evening and looking forward to it. So let's talk about the benefits of checking your glucose level, your blood sugar level. So it gives you a good picture of the body's response to your diabetes care plan. As you probably know, keeping your glucose levels in the suggested target range can prevent or delay complications from diabetes, which is of course something that we all want. It is normal and natural for your glucose level to fall and rise throughout the day. This is normal for someone even without diabetes. It helps you to identify and target certain things that are causing your blood sugar to rise or fall, and helps you find out why you should take steps to keep your glucose level in range. As you monitor your blood sugar more, you come to realize that you feel your best when your blood glucose is in the target range. It's especially important for you to monitor your glucose level if you're taking insulin, if you're having a hard time controlling your blood glucose levels, if you're having low blood sugars without the warning signs of low blood sugars, then it's really important to be checking your blood glucose level more often. And then, of course, if you're sick or having ketones from high blood sugar levels, it's important to monitor more often. So the benefits of checking your blood sugar continued. let's talk about what can increase blood glucose level. Physical inactivity can cause your blood sugar to run higher, but also sometimes exercise can cause your blood glucose to run higher, specifically weightlifting. And so exercise can be difficult to manage sometimes. Even though it's really good for us, it can cause you to have either low blood sugars or high blood sugars. So we can talk more, and you can talk more with your physician about how to manage those numbers. Stress can cause your blood sugar to rise. Sickness can also cause a high blood sugar, even if you're not eating while you're sick. A meal that is too high in carbs, or a meal where you underestimated the amount of carbs in that meal and didn't give enough insulin if you're taking insulin. And then not enough medication or not the right type of medication for you. So those are some things that can cause high blood sugar. And those are just a few of the items. There's actually quite a few other things that can cause high blood sugars as well, such as hormones, which factors into stress. Some things that can cause low blood sugar: if you miss a planned meal or snack, especially if you already took your medicine or gave your insulin for that meal. If you're not eating the appropriate amount of carbs at your meal, that can cause the blood sugar to fall low. And alcohol intake, especially if you drink alcohol on an empty stomach, can cause your blood sugar to get low. The liver really likes to just process one thing at a time. And when you drink alcohol, it inhibits your liver from producing glucose, which is something that your liver does normally, and therefore your blood sugar can fall. So how to check your blood sugar? It's really important that you do wash your hands before you test your blood sugar. Now, I know that this is not always the most convenient. Obviously, we're all in a heightened state right now and probably washing our hands more frequently than we may have in the past. But it's not always convenient to wash your hands. I would avoid using hand sanitizer prior to testing your blood glucose level, simply because some of those hand sanitizers actually can raise the blood glucose level. They have some ingredients in them that can cause it to give a false high reading. So if you don't have access to soap and water, then a good alternative is to use an alcohol pad to wipe off the end of your finger before you check it. You will want to then use a cotton pad to wipe that off and let it dry completely. So you always want to make sure, even if you're washing your hands with soap and water or using an alcohol pad, that your fingers are completely, or hands are completely dry before you check. You'll want to insert the test strip and then use the lancing device on the side of the fingertip, not directly on the pad of the fingertip, just to avoid the pads of your fingers from becoming sore. And then touch and hold the drop of blood to the strip. And then after a short countdown, your glucose level will appear on the meter's display. And so that process is very similar for all different types of glucometers that are on the market. And so they're pretty similar if you have to switch from one type to another. So as far as when you should check your glucose level, really good time, of course, I would encourage you to talk to your doctor about when they want you checking, but really good time to check is your first thing in the morning, which is called your fasting blood glucose level. So first thing in the morning before you eat breakfast. This gives us a good idea of what's happening with your glucose levels overnight. And then either before meals and or 2 hours after meals, depending on what your physician recommends. So the fasting blood sugar, like I said, gives us a good idea of what is happening overnight. And if you're taking insulin to treat your diabetes, then it also gives us a good idea of your long-acting insulin if you're on injections, or your overnight basal rate if you are on an insulin pump. The 2-hour after meal blood glucose levels give us a good idea if you're taking insulin on if you're taking enough insulin for that meal. Or for the amount of carbs that you're eating in that meal. And that's the same whether you're on insulin injections or on an insulin pump. It tells us how the insulin that you're giving before the meal is working, if you need more or less, depending on if your blood sugar is high or low 2 hours after that meal. Before bedtime is a really important check as well, because obviously you don't want to go to bed with a blood sugar that is too low. That could be dangerous. And if your blood sugar is high before bed, then that can give us some information too about necessary adjustments to either insulin or your medication before bed. So again, just ask your doctor when and how often is right for you. So as you can see, it's pretty easy to test, to be asked to test 4 to 6 to 8 times a day if you're checking before each meal, 2 hours after each meal, and then before bed. I didn't want to say that that's easy to do because I do know that it's a lot of work. And even though checking your blood glucose level doesn't take a significant amount of time at any one setting, it does add up and it does take time out of your day. So it's definitely not easy, but it's well worth it because it gives you so much information as far as how your current regimen is working for you. So keeping a log is also really, really important. So on the screen there, you'll see kind of an older style blood glucose paper log. This one is from Canadian Diabetes. If you're the type of person that likes to write it down on paper, that is great. It's really important that you include the time and date of the blood glucose test, the result, and any notes that could tell your provider more information about why your blood sugar was what it was at that time. So for example, you'd want to say if it was your fasting blood sugar in the morning or if it's a 2-hour after meal blood glucose level. If you're really stressed out that day, that might be something that you want to write down since our blood sugars tend to run higher when we are stressed. If you're sick or feeling really tired, if you're feeling like you're having low blood sugars and you check, just make those notes. All of that information really paints a great picture for your provider. So if you prefer not to carry around a paper log and to use your smartphone, there's some really good apps listed there to record your blood sugar levels. So all of those are wonderful. That is not an extensive or exhaustive list of the apps that are available to monitor blood sugar or to check blood sugar and to log it. There are many others out there as well. So if you have a smartphone, I think that that's a really great way for you to log your glucose level because you pretty much always have your phone with you. You don't have to carry around that piece of paper, and then it can put it into a really pretty chart for your provider that you can email to your provider prior to your appointment or even in between appointments if adjustments are needed in between appointments as well. So we've talked about how to monitor and how to record your levels, and let's talk about what those numbers mean and what the targets are. So the American Diabetes Association recommends what's called a preprandial or before glucose level of 70 to 130 for people who have diabetes. And they recommend 2 hours after the meal, which is called postprandial, for your glucose level to have come down to at least less than 180. And what that equates to when you're looking at A1C, which I'm sure you all know the A1C level is an average glucose level over 3 months, and that takes into consideration your glucose level at all times of day. So that's not just when you're checking, but that's all of the times in between, and your glucose level can change every minute, and that's totally normal. An A1C of 7% is what's recommended by the American Diabetes Association, and that's an estimated glucose of 154. So these targets can be individualized based upon how long you've had diabetes, your age, and any other medical conditions that you may have. If you have other risk factors such as cardiovascular disease or advanced microvascular conditions, retinopathy, etc., then your doctor may want to set different targets for you. If you're unaware of when you have low blood sugars, that's called hypoglycemia unawareness, then your doctor may set a little slightly higher target for you to prevent low blood sugars. So of course, there's a lot of individual considerations that go into those targets. And again, those targets are just the general targets from the American Diabetes Association. So the little bullet point over on the right-hand side says that postprandial glucose may be targeted if A1C goals are not met despite reaching preprandial glucose goals. So there's a chart out there, and I probably should have added it to this presentation, and I will do that for next time. But the chart shows that the lower that your A1C is, the higher the percentage of postprandial glucose it matters. It plays a bigger percentage into your A1C level, the lower your A1C level gets. So if you're really working hard to lower your A1C, but you're just kind of struggling at the end to get it to your target, it's really good to target what happens in your after meal times. If you think that you eat, let's say 3 times a day, 3 times a day on average, then that's six to 9 hours a day that is what's considered postprandial glucose level. So that's a significant portion of your day. So I encourage you to look at those numbers as well. That's why checking 2 hours after meals is really important. So now let's talk about hypoglycemia or low blood sugar and hyperglycemia or high blood sugar. So we touched on this before, but some causes of low blood sugar could be too much insulin or not enough food, not eating enough carbohydrates, taking more insulin than needed, or exercise. Some symptoms of low blood sugar include shakiness, sweating, weakness, rapid heartbeat. Hunger can also be a signal, headache, irritability, or just feeling kind of like a loss of control as well. So as you see, there's many symptoms of low blood sugar. However, most people will experience probably 2 or 3 of those symptoms, and those are kind of your go-to symptoms when your blood sugar is low. So if you've ever had a low blood sugar, you probably remember exactly what it feels like, and if your blood sugar were to get low again, it's probably going to feel very similar. It's important that when your blood sugar is low that you treat that low blood sugar. So low blood sugar is actually defined as anything less than 70. So you would want to treat it with what's called the rule of 15. This is really important that you take in 15 grams of not just any carbohydrates, but rapid acting carbohydrates. So a rapid acting carbohydrate is going to raise your blood sugar quickly. And so let's talk about what is considered a rapid acting carbohydrate. So that is a carbohydrate that does not include any protein or fat. So for example, a granola bar most granola bars have about 15 to 20 grams of carbohydrates in them. But they also contain usually things like nuts and fat. And so that's actually going to delay the absorption of the carbohydrates. And even though your blood sugar will eventually rise from eating that granola bar, it'll take longer to rise than if you were to eat something that's strictly rapid acting carbohydrates, such as juice, glucose tablets. There's also regular soda is strictly rapid acting carbohydrates. And you only want to eat 15 or drink 15 grams. So in juice terms, 15 grams of juice is about 4 ounces of any juice. So that is half of a normal serving. With regular, not sugar-free soda, that would be about 6 ounces of most sodas. And also a fun size pack of Skittles is about 15 grams. I really encourage people to carry either glucose tablets or glucose gel. I know from my own personal experience that those aren't the best tasting. However, the body has to do less to break down glucose tablets or glucose gel than it does even fruit juice. And so it's going to cause your blood sugar to go up faster, which is what we want when the blood sugar's low. So, and the great thing about glucose tablets is you can throw them in a bag or a purse. You can keep them in your car. They're not going to melt. So even though some of them, are pretty chalky tasting, I would encourage you to try different ones on the market and find one that you like the best. I think over time they've gotten a little bit better. So that's how you treat a low blood sugar. You would want to wait about 15 minutes and then recheck your glucose level. If your blood sugar is still low after 15 minutes in a 15-gram treatment, then you would want to treat it again and then wait another 15 minutes and recheck. Very rarely would your blood sugar be low after that second check. If it is, then you would repeat as well. And then after your blood sugar comes back up to a normal level, it is important to have a small snack that contains protein in it just to help keep the blood sugar stabilized at a normal level. So now let's talk about high blood sugar or hyperglycemia. So high blood sugar can happen when you're not getting enough insulin or if the insulin's not working properly. Some causes of high blood sugar include stress, illness, eating more carbohydrates than you intended, or not getting enough exercise, being sedentary. Some symptoms of hyperglycemia. This only lists 2, however, there's a lot more. So right here it says increased urination and thirst. So some people, when they're first diagnosed with diabetes, those are 2 of their big symptoms. And those can come back when you have high blood sugar subsequent to diagnosis, which anyone with diabetes is going to, have high blood sugars after they're diagnosed. But sometimes you're not as sensitive to the increased urination and thirst. So some other symptoms of high blood sugar include headache, irritability, and feeling hungry. Now, you may notice that I mentioned all 3 of those as well for low blood sugar. And so that's a really important point. If you've lived with diabetes for a long time, sometimes we become really good at recognizing when our blood sugar is high or low. But even if you've lived with diabetes for a really long time, sometimes it can be a little tricky because the warning signs or the symptoms for high and low blood sugar, they can be the same. So anytime you're like, I just don't feel right, it's never wrong to check your glucose level and see where you're at that moment. So I encourage you, if you're not feeling well, if you feel like you may be high or low, check and see, and then that's just data that you can give to your doctor and make changes from there. So the treatment for high blood sugar could be a change in the meal plan after you've discussed with your doctor, or change in medication again after discussing with doctor. Drinking water can help your body flush out the extra sugar through urination. And then physical activity can usually help bring high blood sugars down as well, specifically cardiovascular exercise. However, I would caution you, if your blood sugar is high and you have ketones in your urine, you do not want to exercise at that time. So speaking of ketones, let's talk about ketoacidosis. So ketoacidosis, or what's called diabetic ketoacidosis, or DKA, can happen when the body does not have enough insulin to convert the sugar in the blood and take that sugar and move it into the cells where it's used for energy. And so the body therefore cannot use glucose for fuel or energy. And so the body has to use something else. So the body starts to break down fat for energy. When fat is broken down for energy, a byproduct of that is ketones. Ketones are acidic in nature, and so the body does not like to be in an acidic state. So the body tries to get rid of those acidic ketones through the urine. And the body does a good job of trying to get rid of it through the urine. However, usually in diabetic ketoacidosis, the body can't keep up, and so those toxic ketones will build up in the blood. And if the ketotic or acidotic state lasts for too long, you'll start to notice that breathing changes, and the body is trying to get rid of those ketones now through the lungs and breathing them off. And so someone who's in ketoacidosis usually has a really fruity smelling breath. So their breath can smell almost like Fruit Loops. They'll also typically be urinating very frequently and very thirsty, drinking a lot of water. Some late signs of ketoacidosis are nausea and vomiting. And then, like I mentioned, a change in the breathing pattern. So fast respirations to try to breathe those ketones off. So you should check for ketones anytime you're ill, regardless of what your blood sugar is. Typically, a sign of ketoacidosis is high blood sugar, but you can have ketoacidosis even with a normal blood sugar, especially if you're sick. And so you want to check for ketones anytime you're sick, regardless of blood sugar level. And then typically the recommendation for other times to check for ketones is anytime your glucose level is over 250. You can buy ketone test strips at the store, at any pharmacy. They are over the counter. And last time I checked, the most cost-effective place to purchase ketone test strips, urine ketone test strips, was at Walmart, and they run about $8 to $10 a bottle, depending on where you live. So I kind of got ahead of myself here, but again, you would want to check for ketones if the blood glucose, this says 300, which is fine for people with type 2 diabetes. If you have type 1 diabetes, typically the recommendation is over 250. If you feel nauseated or you have vomiting or abdominal pain, if you're sick, if you feel tired all the time, if you're very thirsty or have a very dry mouth, if your skin is flushed, if you're having a hard time breathing, if your breath smells fruity or you feel confused or in a fog, those are good warning signs of ketones in the blood. And so you would want to check the urine ketone test strips. One thing I do want to mention is that those ketone test strips, once the bottle is open, it'll tell you on the box how long they're good for. With most brands, it's 3 months after you open the bottle. If the bottle is not open, it's good until the expiration date on the box. On the side of the bottle, there is, and you can see in that picture, there's a little color chart there, and you want to make sure that you dip the end of the ketone test strip into the urine and wait the suggested amount of time that's listed on the directions. Usually it's about 10 or 15 seconds. And then you match the ketone strip to the color on the bottle, and that'll tell you if you have no ketones or trace ketones, if they're small, they're moderate, or if they're large. And you would want to call your doctor anytime that you have ketones so that you could get recommendations from them directly. Some people have what is called dawn phenomenon. And actually all people have dawn phenomenon. Some it is more pronounced than others. And so whether or not you have diabetes, dawn phenomenon is what happens when the body releases hormones while you're sleeping, usually while you're sleeping, unless you're a night owl. And that typically happens between 4 to 5 a.m. Some people, it starts as early as 3 a.m. So people with diabetes don't have their normal insulin response to adjust for this, and therefore you may see the fasting blood sugar go up in the morning. So if you've had a discussion with your doctor where you're going to bed with a really good blood sugar and then you wake up in the morning and your blood sugar is maybe 50, 60, 100 points higher than it was when you went to bed, that can be really frustrating because you're like, I didn't do anything. I just went to bed and I didn't eat anything, and now my blood sugar is a lot higher every morning. And so some things that we can do to help for this is making sure that you're finishing dinner early in the evening, reducing carbs at dinner can help, making sure that you're not snacking late at night or maybe getting ice cream before you go to bed or anything like that can definitely help. Do something after dinner, some activity. It doesn't have to be a huge exercise, but just something to stay active to help reduce your blood sugar. And then if your fasting glucose continues to be high, then your healthcare provider may prescribe or alter your medication to help with that. So let's talk about estimated A1C and estimated average glucose level. Sorry, not estimated A1C, but hemoglobin A1C and estimated average glucose level. So this gives a picture of the average blood glucose or blood sugar level control for the past 2 to 3 months. It represents an average of glucose levels 24 hours a day over a 3-month period, including times when you're not checking. So like I said, that's blood sugar level at every time of day, pre-meal, post-meal, middle of the night. Whereas compared to checking your blood glucose level by finger stick, just measures your glucose level at that one moment in time. It doesn't tell us what happened before or after that check. Apologize, I'm having to take a sip of water because my throat is getting a little scratchy here as I keep talking. So the results of the A1C give a good idea of how well your diabetes treatment plan is working. So a single day's blood glucose test results don't give the same big picture information. So this can help your doctor interpret your finger stick glucose testing that you're doing. It helps give the doctor a bigger picture of what's going on. And it shows how healthy choices can really make a difference in diabetes control. So this is a great chart. I'm sure you've probably seen it before when you go to the doctor's office, but an A1C of 5% would be an estimated average glucose level of 97. So like I mentioned before, the American Diabetes Association recommends an A1C of 7% for people who have diabetes. And so that would be an estimated average glucose of 154, as you can see on the chart. So again, that includes all of the pre-meal, post-meal, and middle of the night blood sugars as well. So if you think about how high the blood sugar can rise after a meal, that's a really good number, 154 average. So now I'm going to open it up for questions. Thank you all so much for attending. I hope that this information has been helpful and kind of gives a good insight as to why us as diabetes educators and physicians may be asking you to check your blood glucose levels more than you may want to, because it really does give an excellent picture to see what's going on. It gives you feedback to know how to make changes in the future, what's working and what's not. So really appreciate y'all attending today. Like Katie mentioned, to type in a question, you'll want to click on the question bar and type in a question, and then I'll be able to see it. And please feel free to ask as many questions as you want. All right, I've had a few questions come in here. Um, One person is asking what is a continuous glucose monitor? And so you may have seen continuous glucose monitors, different ones advertised on TV with commercials here lately. So there's a few different continuous glucose monitors on the market, and they all work very similar. The difference between testing your blood glucose with finger stick versus a continuous glucose monitor is a continuous glucose monitor gives you an updated sensor glucose reading every 5 minutes versus the finger stick just being whenever you do it. And so the finger stick is blood glucose level. You're testing the actual level of glucose in the blood, where the continuous glucose monitor is what's called a sensor glucose reading. And so that sensor, which is a little metal filament, little wire that sits underneath your skin, it's self-inserted at home and changed every 1 to 2 weeks, just depending on the type that you're wearing. It sits in the interstitial fluid underneath your skin. And so it's not a true blood glucose level, but sensor glucose and blood glucose are not exactly the same, but they're always very similar. And so it gives, like I said, it gives a good or updated reading every 5 minutes. And so that gives a good picture of what's going on in between those finger stick blood glucose tests. So a lot of people really like using a continuous glucose monitor. All right, I hope that answers the question. Let's see, we have a few more questions here. So I have a question that says, what are long-lasting carbs? So I talked about rapidly absorbing carbs. So those are things that you want to treat a low blood sugar with. But a long-lasting carb, carbs that are going to stay in your system longer, are things that have a fiber in them. So those are going to be like your brown rice or your wheat bread have more fiber, or your fibrous vegetables. Those are going to not cause a significant, as much of a significant spike in your blood glucose level as a rapid acting carb, because that fiber helps slow down the digestion of the carbs. So that's a great question. Fat and protein can actually also cause a delayed rise in blood sugar level as well. So for people, especially with type 1 diabetes who are on insulin pumps, they may have to take the fat and carb or fat and protein that they're eating into consideration when they're giving their insulin on their insulin pump as well. So the next question is, I have my blood tested and A1C every 3 months. Does this also include checking for ketoacidosis? That's a wonderful question. So when your doctor tests your A1C, that's not testing for ketoacidosis. However, typically when you get blood work done at your doctor's office, they're doing urine checks as well, and they would be checking for ketones in your urine. So those are typically done together, but the A1C test itself doesn't test for ketoacidosis. All right, the next question I see is, what is the best carb count for snacks? Also, what are examples of good snack after dinner and before bedtime? Really good question. So we try to recommend keeping snacks to about 15 grams of carbs or less. Of course, that can vary depending upon your diabetes treatment regimen, so I'd encourage you to speak with your healthcare provider about that. But examples of good snacks would be something that's well balanced in both fat and protein. So you want to choose something that has a well balance between the carbohydrates, the fat, and the protein. So some things that I can think of, you wouldn't want to choose something that's just all carbohydrates because that's going to cause a bigger rise in the blood glucose level. So some things that I can think of off the top of my head are like some of the Greek yogurts that are out there on the market. You have to be careful with yogurt because some of them have a significant amount of sugar in them. But you can find some on the market that are really well balanced between fat and sugar and protein as well. Um, Sometimes milk is recommended as well for a bedtime snack. Um, because it has about the same amount of protein as it does carbohydrates in an 8-ounce glass. Here's a really good question about exercise. So this is any recommendations for exercising to prevent the possibility of hypoglycemia? Yeah, absolutely. This is a really tricky one because a lot of us want to exercise so that we can either maintain our weight or to lose weight. And so if you're having low blood sugars or having to eat a lot of food to get your blood sugar up before you exercise to prevent a low blood sugar, that can be counterproductive. So what I recommend is being consistent with your exercise. It's hard to adjust medication appropriately if you're exercising inconsistently. But if you're exercising on a consistent basis, then adjustments, if needed in your medication, can be made. I really recommend keeping an exercise journal, and that can be as simple as entering it into your phone so that you can correlate what happened with the exercise that day and your blood glucose levels. Also, exercise. If you are a person who takes insulin, I do recommend exercising at a time where you don't have a lot of insulin in your body. So trying to avoid exercising right after you've eaten, where you've given yourself an injection of insulin before you ate, because when you exercise, your body will start metabolizing the insulin more quickly and cause a low blood glucose level. So there's a question regarding CGM readings, and I touched on this a little bit. So the question is the reading on CGM and the finger stick the same? So no, they are not typically the same because, like I mentioned, one is reading your glucose level and one is reading the interstitial fluid, the sensor glucose level. So they're not ever going to be exactly the same typically. You might occasionally see that they are, but they should be similar. The higher your blood sugar level is, the greater the greater difference you're going to see in the numbers because it's a percentage. They should be within about 10%. So there's not any type of correction that you need to do when you're dosing insulin. If you're using the Dexcom continuous glucose monitor, that one is approved for no calibrations, and you can dose directly with that number from your Dexcom. Great question. All right, are there any other questions that I can answer? I love all the participation. Thank you all so much for being here and for asking questions. Really makes it fun and interactive. So I hope that this information has been helpful for you, and I'm going to hand it back over to Katie. So thank you for allowing me to speak with you all this evening. I appreciate it.
Sure. Thanks, Andrea. If you could just advance it to the next slide, I just want to show everyone. Um, Yep, we have a couple of upcoming live events, same format as this one. The topic in September is A Happy Heart is a Healthy Heart. That's going to be on the 24th at 6 p.m. Eastern. And then in October, we will have Diabetes 101, Mastering the Essentials. It's kind of a really good overview of all things diabetes management. And that's in October on the 20th at 6 p.m. And then, as always, we encourage you to visit our Facebook page. Our Facebook group is the Diabetes Innovation Group. And then also, Cecilia Health has a wonderful blog that we post regularly, great tips and good articles referencing all things diabetes and health management. So, um, and that is it. Thank you for joining us this evening, everyone, and thank you for your participation. And Andrea, thank you for a great talk and a great, question and answer and kind of sharing. So, all right, we hope to see you all in September. Yeah, thank you so much, everyone. Have a good evening.